out one of the biggest bad outcomes of COVID-19 pandemic, apart from the economic ravage, the people that died, the people that were hospitalized for long and still are suffering either complications or financial hardships. We have also had a very difficult time with teenage pregnancies all over the country, and we've been working very closely with the Ministry of Health. All over the country, there is nearly 20% teenage pregnancies over that period. In Nairobi alone, 10% teenage pregnancies. We even saw pregnancies as low as 10 to 14 years during that period. And we have now launched a triple threat campaign where we are working with Nyumba Kumi, we are working with our community healthcare workers, we are working with the national government administrative officers, education, and also we are working with a number of parents and also peer educators like yourselves and other younger people to try and do a few things. One of them, of course, is to reduce the stigma of reporting gender-based violence, which includes defilement. In Nairobi also we're having a challenge where some of even the teenage pregnancies are also caused by teenagers themselves. So basically children impregnating children. And so we are working very closely with schools and trying to look at what are the safety mechanisms. Nairobi is a bit unique, unlike other counties, because where we've found out in several settlements where people are not very connected with their neighbors. And so the mechanism for what we call community or social community protection, where your neighbor becomes very responsible, needs a different approach in Nairobi than in the villages where perhaps your neighbor is also a relative or an uncle. So here we are deploying, and again through our community health initiatives, and identification mechanisms for persons who are vulnerable, and especially teenagers who are vulnerable, so that we put them in social support units. And we hope that this could be important in other pandemics, especially pandemics that cause teenagers to be at home, and especially during economic vulnerabilities where people do not have jobs, they're not going to school. And this is something that we are also inviting the participation of everyone. And because we are also reaching out with sex education, we are also reaching out with including enforcement, where also people are not being very responsible also needs to be arrested, and people who are endangering the lives of younger people, especially younger girls, because it is not just affecting teenage pregnancies. We have also seen an increase in STI, we have seen an increase in HIV incidences over that period, and we have also seen an increase, for